Right. So I'll recognize Mr. Peters. Strike the last
Thank
word.
you, Mr. Chairman. I move to strike the last word and discuss an important piece of bipartisan legislation I've been working on with other members of the committee as well as with your staff. First, I want to thank you and your staff for all your effort to bring together this important package today. And the package we're discussing and we will pass extends many critical programs and will ensure that our communities will have access to much of the care that they need and deserve. The package does not, however, deal with one important issue, that of ensuring that seniors will continue to have access to clinical lab diagnostic services in the coming years. I've had the pleasure of working on a bipartisan basis with Mr. Bilirakis, Mr. Hudson, and Mr. Schrader on my bill, the Laboratory Access for Beneficiaries, or LAB Act. When Congress passed the Protecting Access to Medicare Act, or PAMA, we had the goal of updating the clinical laboratory fee schedule so that it's more reflective of market rates for lab services. Unfortunately, the first round of reporting collected by CMS captured only 1% of the laboratory market. And that means that CMS is basing its fee schedule on only a very, very small piece of the laboratory landscape. The resulting fee adjustments for lab services threaten $10 billion in cuts, which is 4 times greater than CBO had projected. Cuts of this magnitude threaten the health of our seniors as they will be delayed in or prevented from obtaining the lab tests they need to diagnose, treat, or prevent disease. If Congress fails to act, CMS will continue to gather incomplete data, adjust rates based on this incomplete data, and further threaten patient access. So, Mr. Chairman, I appreciate the work of you and your staff to iron out a few details on the bill. Hope it can be considered as soon as possible. I ask unanimous consent to submit for the record a letter of support for the LAB Act, signed by more than 25 organizations, including the Infectious Disease Society of America, the Caregiver Action Network, and the American Academy of Family Physicians. And I yield back.